All right, in this video, we're gonna continue going towards finishing up how we do anterior temporary for implant crown. After you get your impression, temporary impression coping that was in the mouth, you get that out of, you unscrew it, you use your implant replica, match these two, fit these two together, tighten your screw up. And then once you tighten it up, make sure it's all the way in. Then you have your impression, you find the groove. This type of impression coping has different lines on it that you can find the direction. There is a groove here on the front. I'm gonna match the groove to the groove line that's in the impression, and I'll just push it in. You want to make sure it's completely secure, and it is. And after you do that, you want to get a little bit of Vaseline and just put it around the margins of your implant, and then you get your soft reliner and you get your soft reliner and you apply it all the way around the margin so that this will give the duplication of the gum tissue. But the Vaseline will help this material not to bond or not to attach. Not bond, I'll take that back. Not to attach to the the Vaseline would help this material not to attach to your abutment. Once this is set, you want to grab your Vaseline again, and I'm also going to direct this because if it leaks too much here, we don't want it to do that, so you want to make sure you kind of cover all of this. But after this is set, I'm going to run another layer of Vaseline right on the soft reline material to make sure this doesn't bond or attach or stick to the stone model. After this, you want to pour up your model here, stone model, pour stone model, and now you have the stone models to go against each other in order to be able to do your temporary crown for the patient. So we got the model ready to go, and let's open this up and go from there. So this is the metal one. They also have a clear version of that, so we can use either or. We're gonna unscrew the abutment that's here. After you remove the impression coping, we're gonna try to see if this fits over that. And if you're not sure, you can remove your soft tissue replica, put it aside, and make sure this goes all the way in there. Once you get that all the way in, you can tighten it. And then after you tighten that, you can slide this over that. So once you put your abutment in, you can pay attention to the gum tissue. The gum tissue is overlapping that. This is the gum tissue that you want to modify by adding more flowable to it, to play with it, to kind of go up or come down farther. So you want to put a little stick in there and look at the draw line and see where the draw line falls. And it's way right into almost facial. You can see right here, incisal of that, slightly towards the facial. But that's okay. I'm going to leave that open. I'm going to build the rest of it up in the chair while patient is here. I'm also going to modify most of the gum line when patient comes in to push the gum away. But everything I'm going to build is I'm going to build everything above the gum from this point on to make it look like a tooth. All right, since this is metal color, I like to go with a layer of opaque all the way around it. And make sure if you got your abutment here, make sure you follow it all the way 360 degrees, because if you don't, they do tend to pop out or break easier if you don't go all the way facial, lingual, mesial, distal. So you just want to kind of connect all of it together. I'm going to try to cover all the metal so none of that metal shows. I'll put a little line on the lingual to make sure it has enough retention there. All right, and you build another layer again. Once you build the first layer, you don't have to go all the way around usually. Still, if you do that, it's more ideal. I usually go ahead and build it on both sides after the first layer and then connect them all with a final layer at the end. This way they're all gonna be one unit instead of two separate pieces, one from facial, one from lingual. This is the important part because we're getting to our full thickness now. So you want to make sure you pay more attention as far as the anatomy goes to make sure you have a nice anatomy based on what lateral needs to be. Now, if you have a problem doing any of this chair side, you might want to send this to the lab and have lab do all of that. But I enjoy it, and it's good to have it handy, especially if you have an emergency case going on. So right there, if you notice, I want to make sure I prevent that from having any kind of undercut, because if you get undercut, then you have to cut the whole thing, and that's not fun either. It would help to put some wax on either side of these teeth so you don't have to worry about that. This is a little bit over bulky, but that's good. I'm gonna flatten it out a little bit more with my finger to kind of extend it to the distal a little bit extra. And you can fine tune these corners later, but that gives you an idea of overall shape of the tooth that needs to be. And the lingual is a little bit bulky, so I'm gonna remove some of that excess. And we should be pretty good shape there as far as the main anatomy and the look of the tooth goes. If you get it kind of stuck in there and you have a hard time getting it out, get one of these hemostats and pop it out. And that's how it comes out. Next thing I'm gonna do is unscrew this and take it out so we can look at it together and kind of go over that next step, which is the most important part of this. This is your facial, this is your lingual, and the gum end of the implant. You can see the difference between where the implant sits and where your gum is. There's this much distance, so you got this much soft tissue that's basically you can form as long as the soft tissue alignment allows you. I'm not gonna build all of this length up, but I'm gonna put a thin layer of opaque flowable in here so I can prevent some of that dark shadow color showing through. And I'm gonna leave it to that until patient comes in. Once patient comes in, I'm gonna gently put this in and see how that would push the gum tissue. If you put it in and the gum tissue starts blenching or you can't push it in, that means it's too thick. You gotta get your burr and smooth it down, make it as thin as possible. And you wanna make it thin enough that the gum tissue barely pushes away, but not enough that it's completely white, the whole buccal tissue. So there's this much tissue. You don't want to make sure all of this shows white. You want to make sure just the tip of it is a little whiter if you're expanding the tissue and pushing the tissue level higher. If not, you want to take all the pressure off of it and see if it will grow around it and move down a little bit farther there. So next step will be, I'm just going to add this flowable all the way across here. And then after I do that, I'm gonna make a smooth transition between the two composites to assure there's no ledge. And after you do that, you're pretty much done until patient comes in. You just wanna make sure your anatomy looks good and make sure everything flows smoothly everywhere. You can see that gum margin, that margin of the implant, this area is one of the most important part of it right here. So you want to make sure there's a flush transition between the two. So I can just cover it up, very thin area, and I'll modify it when patient gets here so that we can get the maximum pressure that we need that's acceptable on the gum tissue. Gently bite, gently go slower. Okay, open. So what we gotta do is fix this area here. Alright, I'm gonna remove it and do some fine changes to it, and then we'll put it back in. Stay open like that, don't pull it down. We got that. All set.